Minister, we had a story based on access information documents yesterday about the cost of caring for, these kids with most complex needs, level 4 care,
Yeah.
up to 90 million last year for 225 kids.
Yeah.
This cost has been raised as an issue over the years by your predecessors. It's been rising. Is there a plan in place to address this, and what is it?
Yes, well, you have to understand that we have a lot of children and youth in our care with very complex needs. It involves a number of staff to take care of these individuals, and what we're doing is providing a care that's very high level, and we find that these costs are rising because of for a number of reasons. People that are working in this area have certain education requirements and experience that are required. So basically, that's certainly the rising costs would be associated with that, and as well, our government's priority is the health and safety of children and youth in care. And we certainly, want to ensure that proper care is given, and in no way do we want to, create a situation where there could be any issues when it comes to those particular individuals.
So the priority is youth and kids in care. Is this the best way to provide this care by, contracting these private sector providers of these services to provide the service?
We think it is at this point. I mean, all our programs are under review at all times, really. And if we see that we can make changes and so on, we certainly will. But this is the best model for us at this point in time. We find that the numbers of children and youth in care are increasing at all times, and we have requirements that we need to meet. We have deadlines we need to, you got to realize as well, this is 24/7 care, and it involves, people that, that have to be, I always say when I speak to people in our department is they have to be a special person to do that, and we're very lucky that we have great people, that are working in this area, and my hat's off to them because a lot of times, it can be very challenging.
You said it's the best model at this time. Has the province or your department done any type of analysis or assessment of what the options are that, basically proves that this is the best option?
Our like I indicated to you before, our department is constantly reviewing programs. We're no different than the rest of Canada. We do jurisdictional scans at times, but like at the present time, this is what we're doing in the province. Sometimes your reaction to these to children coming into care has to be immediate, and you have to put things in place right away. And but at this point in time, I think what we're doing now is we are meeting the needs of our most vulnerable. We are meeting the needs of children at risk, and it's something that we really intend to continue to improve on. It's a high cost, but the high costs are being, it's not only in Newfoundland and Labrador, it's in every province.
You said, how things are done with level 4 care now, best option at this time. Any plans to actively review this, or is it status quo for now?
No, as I said before, our department is constantly reviewing our program offerings. We're constantly looking at ways to improve. We have a dedicated staff doing that, and if there are changes that we can make that can make this better, we will. And that involves looking at what other provinces and so on are doing. But in Newfoundland and Labrador right now, that's what we have. We've been improving on that as best we can, and we will continue to monitor and review our programming.